Hi, my name is Joel. I'm a student at West Texas A&M University. In this video, I will be covering the 5 required demonstrations of hand washing, doning, patient identification, urine measurement, and doffing. All of the required information within this video will also cover the 8 steps in the principles-based checklist. Preventative measures like hand washing prevents infectious diseases from being transmitted from one patient to another. Everyone within the healthcare facility is at risk. Hand washing reduces the risk among healthcare workers, patients, and visitors. Let us demonstrate the proper hand washing technique. We will begin by turning on the water. Make sure the water is warm. Get your hands all covered with water. Apply 3 to 5 milliliters of soap. Keep your hands below the elbow. Use friction to lather the soap. Get between the fingers, between the palms, the back of the hand, and underneath the nails. Okay, rinse off the soap. At all times, try not to splash any of the soapy water or water. Grab a dry paper towel. And with a dry paper towel, turn off the faucet. After washing your hands, you want to apply moisturizer to keep your hands from cracking so that there is less surface area for bacteria to sit on. After washing my hands, prior to entering my patient's room, I get to know their condition. My patient was in a motor vehicle accident and has previously tested positive for HIV. This means I need to wear my gown, mask, goggles, and gloves to protect me from HIV exposure. Let us demonstrate the proper doning technique. Let's start with the gown. Then a face mask. And for demonstration purposes, I'll be using my glasses for goggles. And lastly, gloves. Before we put on the gloves, make sure you tie your gown to make it easier to tie. And then we'll put on the gloves. Make sure there are no holes, no tears, and the glove is not dry, rotting before putting it on. Make sure the glove goes over the cuff of the gown. And we'll do the same to the other side. Also, make sure the glove is the appropriate size to prevent the glove from breaking and to prevent you from being clumsy with sharp needles or any other medical devices. I have gathered all of my supplies and equipment. I can now see my patient. I will now need to introduce myself to the patient. Hello, my name is Joel, and I'll be your nurse for today. I need to properly identify my patient. I will look at their wristband and ask them to state their name for me. Can I restate your name for me, please?
Nano.
Great. And your date of birth?
11/18/1974.
Okay. How are you feeling today?
Good.
Can you tell me what still hurts and what feels better today?
Everything is feeling much better today, although I do have to pee, and I still can't move.
No problem. I can help you with that if you would like.
Yes, please.
I will now need to explain the procedure to the patient. Okay, this is what I'm going to do. I will remove your bed covers, lift your gown, place this urinal between your legs, and place your penis inside the urinal. When you are finished, I will clean your penis with a warm cloth. Is that all okay with you?
Yes.
Let's provide our patient with some privacy now. Who is this beside you?
My daughter.
I'm going to ask your visitor to leave now so you can have some more privacy. Are you okay with that?
Definitely.
If I could please have you step out for a moment, your father would like some privacy. Now let's make some adjustments to make the procedure a lot easier. I adjust the bed to a good height so that I can easily, securely hold the urinal. I lower the rail on the side I am standing on to have easier access to the patient. Bed wheels are locked to keep the bed from moving and urine from spilling. I position the patient in the way they feel most comfortable peeing. As you can see, the patient is urinating and there is blood in the urine from the injury. It was very important during the doning procedure that I wore the proper gear to protect me from the possible exposure of HIV in the urine. My patient has urinated, and I now clean his penis with a warm cloth and place the gown and covers over the patient. Bed rails are raised, bed is in the low position, and bed wheels are locked. We are now in the bathroom measuring the patient's urine output. This side reads cubic centimeters, which equates to milliliters, and this side reads in ounces. As you can see, the patient's urinal output was 300 milliliters. We will now empty the urine into the toilet and dispose of it properly. After handling the urine, I need to remove my gloves, wash my hands, and put on some new gloves to further interact with the patient. Is there anything else I can do for you before I leave?
No, thank you. I'm all good.
Bed rails are now up, wheels are locked, bed is in the low position, and patient's call light is in their hand. Now that the patient's needs have been met, I need to remove personal protective equipment before exiting the room. I will remove the PPE from most contaminated to least contaminated and from body to face. I will first untie my gown before removing my gloves. Grab the inner cuff of the glove and pull it off so that it turns inside out. Then I will remove the gown, making sure that the contaminated part is rolled up within the gown. Before removing the rest of my PPE, I will wash my hands again to minimize the number of germs that get onto the goggles, mask, and face. I remove my goggles. Lastly, I remove my mask. Then I wash my hands once again. After washing my hands, I can now exit my patient's room. Hand washing prevents the spread of infection among the healthcare facility. Hand washing also protects patients, staff members, and visitors from healthcare-associated infections.